Hi, my name is Melanie, and I'm a clinical pharmacist in Allegheny Health Network. Today we're going to talk about how to use the Humalog KwikPen. Humalog is the brand name for insulin lispro. It is used to treat diabetes. The U100 pen can give up to 30 units per dose. The pen contains 300 units, or 100 units per milliliter, with a 3 milliliter pen. The U200 pen can give up to 60 units per dose. That pen contains 600 units, or 200 units per milliliter in a 3 milliliter pen. The pen is given subcutaneously or under the skin. It can be administered up to 4 times daily, no more than 15 minutes prior to meals. The Humalog KwikPen has a shorter pen length with a shorter thumb reach. The pen also has a dose window, a dial, and an injection button to inject the insulin, which is a bit harder to press with a slower injection compared to other pens. There's also a pen cap, and there's also insulin inside that should be clear and colorless. That should be checked before each dose. You will also need a pen needle and an alcohol swab. When you're ready to inject, remove the pen from the refrigerator for 1 to 2 hours so it is not injected cold. This can be uncomfortable. When you're ready, wash your hands, remove the cap from the pen, and swab the rubber seal of the pen with an alcohol swab. Next, remove the paper seal from the pen needle. Twist the pen needle onto the pen until you feel some resistance. Remove the outer cap and save it for later. Remove the inner cap and throw it away. Before every dose, it's important to prime the pen to ensure you get the entire dose and that the pen is working properly. Dial up to 2 units, which you'll see in the dosing window. Hold the needle over the paper towel or trash can, or hold it with the needle facing up. Tap on the side of the pen to ensure that the air bubbles rise to the top. Press the button down to push insulin into the needle and out of the pen. You need to make sure that you see the insulin coming out of the needle to know that the needle is primed. You may need to repeat this step until you see insulin coming out of the tip of the pen. Now you're ready to inject. Swab the injection site with a new alcohol swab. Dial up to your prescribed dose. Inject the pen at a right angle to the injection site. It needs to be flush against your skin. Press the button to inject the dose. As you press, the dial should go back down to 0. After you inject the entire dose, leave the needle inserted for 5 seconds. After 5 seconds, pull the needle straight out. Don't rub the injection area after the injection. Next, you'll put the outer cap back on the needle and pull the needle off the pen. Dispose of the needle in a sharps container. Never use needles more than once. Next, you'll recap the pen and store it in a safe place prior to next use. The pen dials in increments of 1 unit. The pen won't dial to a dose that is more than what is left in the pen. Your dose is adjusted by your provider for optimal blood glucose control. The most common side effect is hypoglycemia, or low blood sugar. You may feel dizzy, shaky, or sweaty. Call your doctor for instructions if you miss your dose. Never double up on doses. The pen should be stored in the refrigerator, not in the freezer, prior to use. You can remove it from the refrigerator for 1 to 2 hours prior to injecting for a more comfortable injection. Open pens can be stored at room temperature for up to 28 days.